To work on pronation and supination training with a band, just make sure it's anchored to something sturdy so we can really drive more movement into the foot without having to worry to lose tension. To work on pronation with some feedback, I'm going to take this band and I'm going to place it right around my foot. Typically, I'll look for the bone on the inside of the ankle and cue patients to find that as well. From here, we can be in any position, from half kneeling to standing, just trying to work on pronating or flattening the arch of the foot. Now we can begin to add more movement with this, having the knee come in and facilitate more motion. Or we can just simply block the knee by placing our hand there and making sure we're not losing the entire lateral side of the foot contact with the floor. So I'm going to try to maintain lateral contact, and then depending on our goal, we can just focus on pronation, or we can focus on driving with the knee a little bit more. Now, if we wanted to reverse this, we would simply just switch our feet and have the band cue us in the exact opposite direction. So, similar to pronation training, if I want to start to supinate the foot, I don't want to lose now medial contact with the floor. Instead, I want to keep that big toe driving down and think about forming as much of an arch or lift into the inside of the foot as possible. Again, we can work this in any position, but typically speaking, if we're going to have some assist come from the knee or the hip here, we're going to stagger our stance so that way we can get a little bit more drive from the knee and the hip, in which case our foot would sort of supinate when we're going to push off.